most people will have a neurosurgeon, and that neurosurgeon should sometimes, if all you're going to have is a biopsy, I mean, many, and most neurosurgeons are able to do that. If you have a tumor that's, needs to be resected, if your tumor is in eloquent brain, like near your motor strip or near or close to your language areas, then choosing a neurosurgeon who is experienced at tumor resection and perhaps experienced at doing awake craniotomies with, mapping and stimulating your language area, your motor area might be important. So a little bit of research may be important. But then in regards to your radiation oncologist, you want to find somebody who's treated enough brain tumors that they're very comfortable with, the ports and the dosing and the grade that you might have and what the proper dose is. And by ports, I mean just the size and shape of the way the beam goes. In regards to your neuro-oncologist, you want to have somebody who's involved in multi-disciplinary trials, who has some experience, and who's been well-trained. And, there's an accreditation for neuro-oncologists in our country now called UCNS accreditation. So the United Council of Neurological Subspecialties accredits neuro-oncologists. And so, you can also find a neuro-oncologist, and that will tell you that at least that neuro-oncologist has been well-trained in an accredited program or has been experienced neuro-oncologist for a number of years. But in the end, you really need to find somebody you feel safe with and that you think is of course, smart and is going to keep you on the cutting edge and knows a lot about your disease process, but also will be your advocate that you feel comfortable with, that you feel safe with. I think that that's incredibly important to develop that kind of trust where you can talk to them about your fears and you know that they're going to tell you the truth and that they're going to push hard to get you the best care that you could ever have.